Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Over the years, there's been a lot of debate about whether or not vitamin E is beneficial for Alzheimer's patients. In tonight's Your Health Report, one doctor talks about a recent study that suggests that vitamin E supplements may be good for some Alzheimer's patients. Take a look. Does vitamin E help people with Alzheimer's? Researchers have been trying to figure out if its antioxidant properties might work to slow the progression of the disease. A new study in the Journal of the American Medical Association found that high-dose vitamin E over a 2-year period did benefit some patients with mild to moderate Alzheimer's.
The effect of this would translate into about 6 months of disease progression prevention.
Dr. Morgan Sauer with St. Vincent says it's important to note that vitamin E did not delay memory deterioration, but it did seem to temporarily protect patients' ability to perform daily activities.
As being able to feed themselves, to get their food that's been prepared for them and take it to the table, dressing themselves, bathing themselves, meeting the needs of nature.
Dr. Sauer doesn't recommend people go out and take a bunch of vitamin E because there are some risks to it. He says this study shows that vitamin E only benefited people with mild to moderate Alzheimer's who were pairing it with certain medications.
When people who had Alzheimer's were taking medications from the acetylcholinesterase inhibitor class, like rivastigmine, donepezil, or galantamine, and vitamin E was added, that's where the benefit was seen.
Now, Dr. Sauer says this was a very small study, just over 600 patients, so he believes it's more important to take a look at other studies that show risks of taking vitamin E. He also says a much larger scale study is needed. Well,